Hi, and welcome to Three Questions with. Today I got my friend Michele with us. Michelle's from Healthcare Consulting Services. Hey, Michele, welcome to the show.
Thank you so much, Kevin. I appreciate you having me today.
So let's talk a little bit about your business. Tell me a little bit about your background and why you started the business.
Okay, well, I'm an 18-year cancer survivor, and in the meantime, I also acquired my master's in healthcare management administration from Southern New Hampshire University, as well as my bachelor in community and human services from SUNY Empire State College. And I have such a passion to help people that have been recently diagnosed with cancer because, like I said, I'm an 18-year cancer survivor, and I know what it's like to go through treatment, and I want to be there to support them and be a liaison between them and their medical team, and also help them, with the insurance, with their bills, just to make sure that they are receiving everything that they need to receive, to include, medications and hospital stays, and just make sure that, the I's are dotted, the T's are crossed, and that we're all on the same page. And I want to be the voice of cancer and to help people.
Now, Michele, can you also help their families?
Absolutely. It's really like a daunting time when someone's diagnosed with cancer. I mean, family members, it's hard because sometimes they just don't understand. Like I said, I'm a survivor and I know what it's like to go through it. And family members just don't know what to say. So I would be there to help them, like to support them, because I'm not a medical professional, and just to guide them through being supportive. And it could be the littlest thing. You hold somebody's hands, or lay down with them, or just try to talk with them and ask them how they're feeling, and just understand if they're not willing to talk, then it's okay, because it's a process. It's just a learning process.
But you brought up a great point. A lot of times people don't know what to say, so they don't say anything. They stop calling and checking in on you. They stop visiting. It's like, I feel bad for her, but I don't know what to say or do. So the natural thing is just to turn my back on them when they need you most. I'm sure you went through things like that.
Absolutely, I did. I had a good friend that I grew up through childhood, and I remember meeting her like in the drugstore one day because I had to get my prescriptions, and I was running 104 fever. I had an infection from an Infusoport, and she saw me. Now, when I look at myself, I don't see what she sees, but like cancer patients generally have that off color about them, and the hair loss too, so the hat, hence that. And I could see in her eyes like she was taken aback. It's almost like she wanted to cry and like get upset. And I mean, I understood because she didn't know what to say. And that's okay, because sometimes if you don't say anything, that's all well and good, because people don't know what to say. But I could just see that she had that feeling for me, and that made me feel better. That's just like my perspective. So it does happen.
But like you said, in our previous conversations, unfortunately, this is hugely overwhelming. You get a diagnosis, and, you're going to the doctors, and, you're scared, and you're trying to listen for everything, but, they use terms you might not be familiar with. So you can kind of help guide people through, hey, this is what's going to happen, both health-wise as well as emotional-wise.
Correct.
Yeah,
yes, absolutely.
That's a kind of a real big need and stuff. So to be able to do that for people, because they don't know what to expect.
No, you don't. And like I said, I was in the dark. When I first went for my chemotherapy treatment, I had no idea what to expect. I sat on, the doctor's table there, and he gave me 4 injections via my hand the first time because I didn't have the Infusoport. And he's like, okay, this one drug, you're going to feel a little dizzy. And I'm like, okay, and I did. And then I went home. And then a few hours later, then the nausea started, the vomiting, and that was 19 hours every hour on the hour. So it was a horrible experience, but I want to make sure that I'm supporting the person. And listen, Kevin, not a lot of people not going to want to know what to expect. And that's all well and good, and that's fine. But if you're the type of person that wants to know what to expect, yes, I will be there to support you and tell you, like, A, B, and C, and this is going to happen. So how can we prevent, having vomiting? Well, there's plenty of prescription drugs out there on the market that will help with that. And the doctor actually finally gave me that for my second treatment, and I had a little nausea, but no vomiting. But that was like a godsend in and of itself. So there are treatments out there that can prevent these things.
So Michele, how can people learn more? Do you have a webpage, social media accounts? How can they learn more about what you're doing?
Oh, of course. I have a website. They can go to cancercare healthconsultant.com. On my website, there'll be all the links to social media, so you could take a look around. You could see a little more about me, see if I resonate with you. If I resonate, that's great. If not, that's all well and good, but I'm just here to, like I said, to support cancer patients. And I have this calling because I love helping people. And this I hold near and dear to my heart because, Kevin, I'm here. It's 18 years later. And like I said in our previous conversations, I am here for a reason. And that reason is to be the voice of cancer and to help others.
Michele, I really appreciate you taking some time out of your day to jump on the show with us.
Of course. No, thank you for having me. I really appreciate it. Thank you so much. And thank you for supporting me as well.
Have a great day.
You too, Kevin. Thank you.